Anyhow, let's move along. In an effort to stem healthcare costs, this is truly bizarre. Large corporations like Walmart are paying for firms like Castlight Healthcare, Inc. to collect employee data to identify which workers are at risk for things like diabetes. They're also mining data about which prescription drugs workers use and how they shop in order to predict health risks for individual workers. Aside from how creepy that is, the problem is that employers could use this information to discriminate against workers based on their health. If this is all about employers saving health costs, why don't we just do away with employer health insurance altogether and extend Medicare to everyone like Bernie says? Simple solution.
If we just cut off the last half of that sentence, you're correct. Why don't we just get employers out of health care altogether? I'm right on board with you.
Why do we need insurance companies?
You don't. Anytime you pull insurance companies out of the system, the prices drop by 80%.
No, they drop by about 25%.
I have the number. No. I'll send you the data set after this. If you look at the surgery centers in Oklahoma and Texas region that are putting cash prices on their websites. Surgery Center of Oklahoma is charging 20% of what the nonprofit hospital down the street is charging, and it's not just him. There's surgery centers all around him that are in the same bracket. I'll send you the data because it's there.
No,
These free market guys are charging 20%.
But my point is the health insurance companies are skimming 25% off the top. Medicare is skimming 3% off the top. That's if my math is right, that's a 22% difference, right?
Your math isn't right on that because of the way that Medicare and Medicaid do that data is that they don't count actually how much it costs to run the buildings and the employees per se. So they're doing false math on that. Plus, they're not growing, they're not doing research, and they're not allowing the market to grow.
Most government overhead figures, they do incorporate.
A lot of government figures variables. They do, and in those they never have. It's been a major problem.
In Medicare, there's no gold-plated bathrooms in the corporate jet for the CEO. There's no big bonuses for all. I mean, like United Healthcare, the CEO of United Healthcare, Stephen J. Hemsley, has taken over $1.6 billion in compensation. That's money that was all taken away. That was no little girl. You cannot have brain surgery. Sorry. Or whatever it may be, and they've got over 100 executives who make over $1 million a year. Medicare doesn't have any of that, and let's get some other people into this.
Yeah, I mean, I completely agree. I think that it's beyond being really creepy and disgusting. I think it just shows that people need health care. I think that people need, a public option for their health care. I think that, if we're getting to the point where we're trying to determine which of your employers might be pregnant, might be at risk for diabetes, to sort of fire them or get them off your workforce, I think that's disgusting. I think if you can't see that as a real sort of wake-up call for
I'm sorry, she called me out on that. This isn't about trying to fire somebody. What these guys are trying to do is because the government has incentivized employer health care. You can't get health care without getting it through your employer effectively in our country because of the laws. So what these guys are trying to do, and if you follow what they're trying to do, they're trying to spend their money efficiently. No. The problem is they can't fire.
Say this isn't going to lead to someone getting fired.
Well, you just made the assertion that is the reason.
Just a simple question. If your employer was data mining your credit cards to look at what you're buying when you go to the supermarket and finding you're buying too many Oreos and not enough lettuce and tomatoes, and fires you because you're at risk for diabetes, how would you feel?
If they're data mining me for that and then firing me, guess what? It's not creepy. That's probably against the law.
No, it's perfectly legal.
And now I can actually...
it's perfectly legal.
Why is it okay for prospective government employees to have their data mined? Credit reports, health issues. You go into government now, you have to submit a form. No matter what government job it is now, you have to submit a credit report. You had to submit all these things, and the government data mines
Well, if you're opposed to that, I'm opposed to that too. Okay. I guess we're in agreement, Kevin. Thank you.
But it's happening
That's great.
now.
Yeah.
Okay.
So let's put a stop to it.
But here it is, Tom. I am in a government health care. Veteran, VA.
Oh, so you're taking socialized medicine?
Yeah, I'm taking socialized medicine, and we're getting what? I've earned a socialized medicine with a 7-year commitment in the military. Yeah. But I'm saying to you, why do we have waiting lists? So you're going to tell me that
I got a waiting list
excuse me, Tom. Let me finish. You're going to tell me that the government that can't do for 13 million vets is going to do for 300 million people under Bernie Sanders' program? I've been to Europe. I've seen Europeans that come from France go to Spain to get procedures because they can't get them in France because of waiting lists. Canadians.
Spain has a national health care system,
yes,
too.
they have. France has one, too. Every European from Norway to Spain goes to other countries because those countries have waiting lists. Canadians come here.
Kevin, you're hallucinating.
Excuse me. I was there, Tom. I've met these people.
I lived in Europe for a year.
Okay, you tell me, Tom, why do Canadians come to the Finger Lake regions of New York to get care and go to Florence, South Carolina to get common dental procedures done because it's such a waiting list up in Canada?
The reality is that
The
more
reality is
Americans
true.
leave America for health care than foreign people come to the United
Really?
States.
I would like to see those numbers.
Look at the dental clinics in Mexico. Look at the
Look at the dental clinics in Florence, South
look at the
Carolina.
osteopathic or whatever it's called, the surgery centers in Thailand. I mean, this
Cash
is
and cash.
major.
We just
major
put
dis-
cash and cash.
Well, now
these
health-
aren't socialized. The
Now
first two
insurance
options that
companies
you
are
mentioned.
actually paying for these things.
Yeah.
I'm
No,
sorry,
they're
Bridget.
not.
You got
Canadians are coming across the border with U.S. dollars
Bridget,
to get these
you got
treatments.
interrupted. I'm sorry. You were
No,
mid
it's okay.
sentence.
I really think that the bottom line here is that people, they deserve to have privacy. I think it's disgusting to be mining people's data for what they're buying, their healthcare needs,
Credit
to
reports.
make some sort of
Yeah.
decisions about their hiring or how
So
they're
at
treated
least we
at
all
work.
agree that we should pull employers out of the system.
Yeah.
Definitely.
I
We
guess
should
so.
pull the government
Yeah.
out of the system, too.
Sure, sure. And how about we also all agree that using credit reports as hiring criteria